Doctors, would you like more of your patients to say yes to your treatment plans? Well, in this tip, we're going to go over the top 3 mistakes that are destroying your case acceptance. Okay, so in this tip, we're going to go over the top 3 things that are destroying your case acceptance. So the first tip is present the full dollar value. How many times has this scenario occurred? You sit down with the patient, you're showing them pictures, you're showing them the x-rays, they're nodding their head incessantly, I want to do that. And you go, okay, and to do that, you're going to need 2 crowns, and we're going to get it all done on Tuesday at 9 a.m. It's going to take about an hour and a half. They go, And they look up at you and they go, okay, good, so how much is that going to cost? And you go, yeah, I don't know. You don't quite say it like that. You say, that's a very good question. Every insurance is slightly different. I don't want to misquote you. So Jennifer, Jessica, Mike at the front desk, they're going to help you out. But I need to see you Tuesday. They go, okay, great. And you leave, you go, case accepted. Only to walk out later that afternoon and go, did Jeff schedule? And no, he didn't. Why not? Because when I got out of the chair, I go, The only thing I'm saying to when you say, Mike, Jennifer, Julie, they're the expert is, oh, they're the expert. Let me go talk to them. So you haven't presented a full treatment plan. And as the patient, I can't make an informed decision if I don't know how much it costs. You operate the same way. You have vendor after vendor after vendor show up at your office, show you cool pieces of equipment, show you new supplies, and the question out of your mouth is, how much is it? Because you can't make an informed decision unless you know how much it is. The patient is the same way. I get to the front desk, and the front desk, the treatment plan coordinator goes, okay, so we're going to go over your treatment plan. And typically 9 times out of 10, the patient goes, what treatment plan? Like, I don't even understand that I need a treatment plan. You never put me to a decision. There's no cost associated with it. If I do, okay, good, how much is it? They go, well, it's $2,000. Your insurance covers half, your copay is $1,000. I go, $1,000? No, that can't be right. I got Blue Cross Blue Shield. I've got Cigna. I've got Aetna. I've been paying $8 a month for this insurance. They're supposed to cover it all. You could pencil me in for Tuesday at 9, but we need to sort this out. I'm not coming in. And that's because you're not presenting a full treatment plan. When those disagreements occur with the patient and the full treatment plan, you should be there. So if you're not presenting a full treatment plan, there's no way the patient's making an informed decision. So tip number 1 is, on Monday, go in, and I don't care if you don't know it to the penny. The patient doesn't need to know it to the penny. You have a pretty good idea of what these services are going to cost. 2 crowns, a 3-unit bridge. Look, the 2 crowns are going to be anywhere from $700 to $1,200. You need 2 of them. Insurance sometimes covers half. Do you have insurance? Yeah, okay, well, that's going to be roughly. They're not stupid. They know they have to pay for this stuff. They're running the math in their head, and they're going to give you a reaction. And that's what we want. We want them to have a reaction in front of you, not in front of the front desk, because you're the best person to handle any considerations or concerns that come up. So try that on Monday. Don't ask them to pay. Just mention a price. A full treatment plan has been given. You will get a reaction. Okay, let's get into tip 2. Tip 2 is one of my favorites. If you are presenting a dollar value, or even if you're not, you are going to get objections. And there's a slew of objections that you can get. I don't have any money for this. I don't have any time for this. I need to talk to my spouse. I only want to do what the insurance covers. Can you file the predetermination benefits? I'm old. I'm on a fixed income. I could go to Tijuana for half. I mean, the list goes on and on of objections. The biggest mistake made, tip number 2, is not acknowledging an objection. So what do I mean by that? What have I seen happen? And now, guys, we do the new patient workshop. I do a lot of the seminars here, and we run this drill. I'll do this drill, and I'll play out a scenario where I'm the provider, and I have a patient in my workshop, and also my employee, and we go through presenting 2 crowns, and we say it's $2,000 or it's $3,000. It's fee for service. How would you like to pay for that? Whether I ask them to pay or not, following tip 1, just mentioning a price, patients typically know that that's what their cost is going to be. They know they're responsible for it. Dentistry isn't free. My patient gives an objection, the most common objection. I don't have any money for that. Gee, doc, that's a lot of money. I wasn't expecting that today. I don't think I have that. Some form of that objection. And I go around the room and I ask them, oh, what did you hear? What did they say? Oh, the patient doesn't trust you. The patient doesn't value the dentistry. The patient doesn't find it important enough to do. I'm like, one for one, we do this drill. And I'm like, that patient literally said nothing, none of that. All they said was, that's a lot of money. I don't know if I could do that right now. And what's happening is because there's an interpretation of what the patient is saying, it leads to a non sequitur response to the patient. It doesn't make sense. The patient goes, I don't have any money. And the doctor goes, oh, well, if we don't do this now, it's going to cost more in the future. And every doctor who's watching this goes, yeah, of course it is going to cost more in the future. Yes, it is. I know it's going to cost more in the future. You know it's going to cost more in the future, but that's not what he's saying. The objection is, that's a lot of money. I don't know if I could do that right now. Now, we have two outcomes here, right? Either I have no money is true or I have no money is false. If I have no money is false, well, how is telling the patient it's going to cost more in the future get them to go, oh, okay, yeah, I could see that. I really want to do it? It's not. They really have the money. I could pay for it if I want to. All they're going to come up with is another reason why they can't pay for it. Does everyone see that? I have no money, but that's not really true. The real reason I don't want to do this is because I've had a bad experience in dentistry and I'm not going to risk it again. I could pay for it, but I want to go on my trip. There's nothing you're going to say that's going to get me to cough that up by dancing around it like that. If it is true that I really don't have any money, now you're just rude because I don't have any money, and how is telling me it's going to cost more in the future help me? It won't. So instead, start agreeing with the patient. It'll allow you to ask good questions. It'll also let them know that you heard them and possibly you even understand them. The real question is $1,000 a lot of money to a lot of people? Is it? I would imagine most of you said yes. So couldn't you agree with the patient then? When patient says, well, that's a lot of money. I don't know if I could pay for that right now. Why don't you just say it is a lot of money? It is a lot of money. I know it's a lot of money. I've been doing this for 20 years. Dentistry's never gotten cheaper, not once in 20 years. And in that 20 years, I've never had a patient who walked in, knew exactly what they needed and how much it's going to cost. Not once has it happened. And they certainly don't walk in here with $1,000 cash ready to go for a service that doesn't even bother them, and they didn't know they needed till 7 minutes ago. I know that. I've been doing this a long time, Jeff. But I do have a lot of patients that walk in here that are in pain and they can't chew, they can't breathe on it, they can't even sleep. If you walked in like that tonight and we had to do this, we needed to do this, is there any way that you could possibly put the $1,000 on a credit card? And the patient looks at you and goes, well, yeah, I could. I just don't want to. I'm going away next month. Do you see the difference, guys? By having a real interaction with the patient, just listening to them and agreeing with what they're saying, it allows you to ask the question you really want to ask. Can you file the predetermination first? Well, what am I going to say to that? Well, yeah, of course I could. Absolutely I could. I will. I'm going to press the button. It's going to be back here in 3 weeks. But let's say when it comes back that they're not covering it. Are you doing these 2 crowns anyway? They're not covering it? Yeah, of course I'm doing the 2 crowns. I don't want to lose my teeth. Good. So we ask a few questions by acknowledging what they're saying. It allows us to continue the conversation. I don't want to get into an argument with the patient. Those types of responses is a rebuttal response when you're saying, if you don't do it now, it's going to cost more in the future. So we don't want to do that. And it is a killer of case acceptance. Your patients aren't dumb. They understand things. They don't need to be a dentist. So talk to them like you get it. Tip number 2, when they give you a barrier, acknowledge it. Agree with it. And then ask the next question. It'll take you down a line of questioning that will get a real answer from the patient. Got it? So try it on Tuesday. Present the treatment plan like I just said in tip number 1. Give a dollar value. Look for a negative response. Look for any response. And then ask about it. Finally, tip number 3. Oh man, this is an absolute killer of case acceptance. And believe it or not, it's time. Time is the number 1 reason why you don't have the case acceptance that you'd like to have. And, let's think about it for a minute. When was the last time you made a $2,000, $3,000, $5,000, $40,000 decision in under 4 minutes? Never. Maybe once. Maybe it was an emergency. Okay, so let's be clear about what we're talking about with case acceptance. I'm not talking about the guy who comes in pain, and would sell his kidney to get this thing done. I'm talking about the other patients that aren't in pain, didn't know they needed it until 7 minutes ago. So time is another killer of case acceptance. If you are in your exam and it looks like it's going to be a big case, it's over 1,000, 2,000, 3,000, make a number up. If you don't know the patient, it's a new patient, just bring them back for a second consult. There's no good reason to try to sell a $2,000, $3,000, $5,000 case to someone in under 7 minutes. It's not going to happen. And it gets even worse at the front desk. If you let it happen at the front desk and you're understaffed at the front desk, what happens? The phone rings and now I'm out the door. And if I don't need to put any money down to make an appointment, I'll make an appointment just to leave. So I don't have to deal with this. This is why you have cancellations and no-shows. So tip number 3 is time. If you are finding that you're walking into an exam and it's going to be a rather large case, and large is subjective here, everybody. I'm not talking about selling a $50,000 treatment plan. I'm talking about selling a $2,000 treatment plan. I mean, that's a good day. If we could get 2 crowns on the books, and they're done in an hour, that's fantastic. I have my production of hygiene, great. It's worth my time to guarantee that 2 crowns show up, then book 2 crowns and cross my fingers. So if you're finding that you have 0 time, we want to bring people back for second consults. And all of you are going to say, well, I don't have time for second consults. Sure you do. Sure you do. How many cancellations and no-shows did you have this week? You've got all the time in the world. It doesn't look like you have time because you're booking your schedules with cancellations and no-shows. You just don't realize it's a cancellation and no-show. So let's start some new habits this year. If you walk into an exam and you realize this is going to be a big case, just bring them back for a second consult. It's free anyway. Now don't scare them. I mean, if it's not life-threatening, it's not life-threatening. Okay, good. Obviously, there's some work that needs to be done here. I need to get everything together, and I want to give you the time to ask me questions about it, and I want to give you that attention that you deserve. So can you come back on Tuesday at 3 p.m.? It's completely free. It's just an extension of this. It's simple, guys. I'd rather put somebody in for 30 minutes in the afternoon and have that not show than put them on my books in the morning for an hour and a half or 2 hours and them not show. That is a problem. I was guaranteed that a consult is 0 production. I'm not banking on anything else. But 2 hours over here, I'm thinking it's going to be $2,500, $3,000. So tip number 3 is time. So those are the 3 tips, guys. And if you apply one of them, any of them, you're going to get more case acceptance this year. I hope you liked it. I want you to hit the subscribe button and the like button. If you have any comments, leave it there for us. I look forward to seeing you in our next tip. Take care.